I'm Dr. Sara Oldham. I'm family medicine trained, board certified. I've actually been at St. Mary's for almost 7 years now. I worked as a hospitalist up until this point, and now I've transitioned to the director of St. Mary's Rehab. My background, I've actually been taking care of rehab patients since 2021, and I've slowly progressed now to the directorship role, and I'm there full-time now. So the rehab is set up for a multitude of patients, actually. We service all of Northwest Oklahoma and actually even up to the southern part of Kansas. And the patients that we can take in is, say a loved one is hospitalized for a trauma, a fracture, a stroke, even just generalized debility in the hospital. They come in and they're not ready to go home. They need more physical therapy. They need more occupational therapy. They need more resources to be safe to transition back into the home. Those are the patients that we can take in. Anyone that's not walking the way they were walking before, maybe they need training in adaptive equipment, being a walker, a cane, a wheelchair. Anyone that's not at their regular baseline that goes into the hospital, we can take from that setting. But also, I think what's really important and not very well known is we can take patients from home. Say your loved one's at home, they're just not doing very well. They aren't as active as they need to be. They're having trouble getting up from a chair. They're having trouble walking long distances. They might have, they like to garden or they like to go out into the community and they're not really able to do those things anymore. We can actually assess those patients from home, bring them into our facility, have intensive rehab therapy with our occupational therapy, our physical therapy, and get them ready and try to be successful at home for longer. And I think that's a resource that not a lot of people understand that we can do. I want just to make it more known that we're here. I think a lot of people and a lot of physicians and mid-level providers that are in our area don't know that we are here. So putting the word out that we can take people from home and we can have referrals from home health agencies and outlying providers and areas, just to remind them that we are such a strong resource here for the Northwest Oklahoma community to keep patients in their home, to make patients safer within the home. I think that's a really large goal that I have. Another goal is that the medical complexity of patients that I'm comfortable taking care of now is really strong just because of my background as a hospitalist, also background in family medicine training. I kind of have a lot of little tools in my chest to take care of a lot of different types of patients. So just broadening our resources to show the community that we're here and that we can take a very wide variety of patients to our rehab. So another goal I have as director is just letting the people of Enid, letting the people of Northwest Oklahoma realize that even though you have a procedure maybe somewhere else, at a different facility, under different doctors that aren't associated with St. Mary's, we are still able to take you from that hospital setting, from that procedure setting, we are still able to take you here back to St. Mary's for local rehab care. And I think that's really nice for families to not have to drive so far to visit their loved ones. It's more familiar area. People are more familiar with St. Mary's that are part of the Northwestern Oklahoma community. So I want to get that out there as a director goal of just reminding everyone that we're here, that we can take people from anywhere, any facility, really any time as well, as long as we work together with our referral liaison and myself and the discharging doctor, that we're here as a resource at all times.